Oh, we're talking about radiographic anatomy of the upper limb, but this time around we'll focus on the hand. My name is Nicholas Sivura, an anatomist, radiologist, and a clinical scientist. This video is specifically designed for 200 level medical, allied health, anatomy students, and postgraduate students in medical physics and biomedical engineering and others who will find the video interesting. They can equally benefit. So if we are talking about radiographic anatomy of the hand itself consists of the lower end of the forearm, the carpal bones, the metacarpals, and the phalanges. And in the course of doing this, we'll be talking about the views that we usually do for the hand. They are usually PA, lateral and PA, lateral and oblique views. And we want to make sure the bones are aligned. So what we're talking about, and how do we know that the bones are aligned? By the time you look at the soft tissue and the relationship of the bones to each other, that helps in telling you they are aligned. Well, however, we'll be starting off with the distal end of the forearm, which basically consists of the radius and the ulnar. The radius is the broader one, and the ulnar is the smaller one. And the ulnar has a head, has the ulnar head. Between the ulnar and the radius, there's the distal radio-ulnar joint. And each of them has the stylus process on the radius, and the stylus process is on the ulnar. Furthermore, we have the carpal bones, which is part of the wrist, and the radius actually takes part in the formation of the wrist joint. So we'll be talking about that later. But the carpal bones, you can always remember with some mnemonics. We equally talk about that soon. Then you have the metacarpals and the phalanges. So the carpal bones are 8 in a row, 8 altogether. There's proximal row and there's the distal row. And you want to find out how you can remember them. First, you have this scaphoid, lunate, tracheatrium, pisiform. Those form the proximal row. The distal row is formed by the trapezoid, trapezium, trapezoid, capitate, and the hamate. The capitate is the largest bone of all the carpal bones, and the trapezium forms the joint with it's usually at the base of the thumb, of the metacarpal of the thumb. So after those bones, for you to remember this, you have a mnemonics that you can use. when we were in the medical school, that's what we were taught. And that bone, that mnemonist can easily say, Sammy left the party to take Cappy home. And this is what we're talking about. Sammy left the party. Sammy left the party to take Cappy home. So you can remember that mnemonics. That is the scaphoid, the lunate, the trapezium, the pisiform, the trapezium, trapezoid, the capitate and hermit, and the hook of hermit. On the metacarpals, you have 5 bones, and you have 5 of them. 1, 2, 3, 4, 5. This is the first metacarpal, second, third, fourth, fifth. And on the phalanges, for the thumb, we have 2. That's the proximal phalanx and distal phalanx. All others have, the rest 4 have, they have 3. That is the proximal phalanx, middle phalanx, and the distal phalanx. This is the little finger, which is 1. This is the ring finger. This is 2. This is the middle finger. This is 3, and this is 4, and this is 5. So we'll now go further to talk about the joints. Like I said earlier, the first joint is the radiocarpal joint, which is formed between the radius and the carpal bones, and more with the scaphoid and lunate. What we are seeing here, this lucency that's like a curve, is the joint. And in our earlier video, we described the joint space as having contained cartilage, and because it doesn't have calcium, so that is why it's appearing lucent. So you have the first radiocarpal joint, and in between the carpal bones, you have the lucencies too. Those are the intercarpal joints. Okay. And you go further between the carpal bones and the metacarpals, you have these lucencies, and these lucencies demonstrate the metacarpal joints. And when we go further, we have these lucencies at this area, that is at the end of the metacarpal, at the head of the metacarpal, and you now have metacarpophalangeal joints, and there are 5 of them. 1, 2, 3, 4, 5. And now go further. Between the phalanges, we now have the proximal interphalangeal joint, 1, 2, 3, 4, and the distal interphalangeal joint, 1, 2, 3, 4. However, we only have 1 interphalangeal joint in the thumb, because it has only 2 phalanges. And when we are talking again, we'll talk about the soft tissue. You will not ignore the soft tissue. This is the soft tissue shadow that we are seeing. But sometimes you can get swollen, sometimes you have some clinical significance. The shaft itself, the metacarpal has the head, the shaft, and the base. This is the metacarpal of the fourth finger. And the phalanges have the proximal, the middle, and the distal phalanx. Okay, so these make up the radiographic anatomy of the hand. We shall be talking more on in my next video. Please remember to like, subscribe, and share, and put on the notification button so that you can see more series. If there are questions and comments, please drop them in the comment section. They'll be responded to. Thank you.